All right, hello everyone. This is Dr. Mimi Tan. I'm a bariatric surgeon here at Aviva. Thank you for joining us today. Today we're going to talk a little bit about bariatric surgery as well as other weight loss options and tools that are available. This seminar is going to take about 20 minutes just to go over all the content, and then at the end we'll do kind of a question and answer session as well. So if you have any questions, do feel free to just submit them in the YouTube chat, or if it's easier for you, just text us at this number right here, and we will get them answered at the end. All right, let's get started. So, I like to start out with this seminar with a question. And the question is weight loss hard? And it might seem like a little bit of a silly question to start a seminar like this with, but I think this is actually a very, very important question. And it's important because we as a society have answered this question incorrectly, in my opinion. We as a society have said over and over and over again, you've probably heard this again multiple times a day, is that weight loss should be easy. It all that it takes is eating a little bit less, exercising a little bit more, having a little bit more willpower, and the weight should just come off, right? The fact that, and if you are here today, I want to applaud you because you have heard that over and over and over again. And at some point you have said, no, actually, weight loss is incredibly hard. Is there something else that I can do to help myself in this situation? And you're absolutely correct if you have told yourself that weight loss is incredibly hard. And I will tell you why. This is a graph from the CDC, and it looks at weight trends in the US over the last 60 or so years. And each of these lines represents a BMI category. If you're not familiar with BMI, it's a ratio of your height to your weight. And based off of your BMI, there are categories including kind of normal weight, overweight, and then obesity as well. And BMI is certainly not perfect. That we can talk all day about the things that are maybe not good about BMI, but it gives us a general sense of how healthy you are with respect to your weight from a population level. And each of these lines represents one of those BMI categories, including overweight, obesity, and severe obesity. And what it shows is that two important things. One, it shows that obesity rates have steadily been increasing over the last 60 years. And then as of 2017, over 40% of the US population fits within that obese category. And then more than 30% of the US population fits inside that overweight category. And so, again, BMI is not perfect, but what this tells me is that the majority of people in the US, the majority of adults in the US, are struggling with their weight to some degree. And this graph only exists because weight loss is incredibly hard. This graph simply would not exist. This green line that's increasing over time, that wouldn't exist if weight loss was an easy process. And so the question is, why is weight loss so hard? And this is a very complicated answer because there are so many things that go into how much someone weighs and how difficult it is for you to lose weight. These are just some of the things, diet and exercise. Some of these things you do have some control over, right? Like how much you eat, how much you exercise. Um, but at the end of the day, one of the big things that you don't have easy control over is your biology, who your parents are, what your body chemistry is, what your hormone balance is. These are all things that are kind of outside of your control that actually hugely impact how much you weigh and how hard it is for you to lose weight. And so, if you are someone who has tried over and over and over again to lose weight and have not been successful, or maybe you have been successful, but you haven't been successful in keeping that weight off, what I want to tell you is that this is not a moral failure. Not being able to lose weight successfully is not because you didn't try hard enough. It's not because you're lazy. It is a failure against your biology. It's a failure against something that you don't have easy control over and you have been fighting an uphill battle for far too long. And I want to say that you don't have easy control over it because we now have tools that make weight loss more effective and make weight loss a little bit easier for people. And we're going to talk about each of these tools in the next couple of slides. So the first tool is diet and exercise. This is kind of the go-to for many people is, again, increasing your exercise and decreasing how much you're eating. And this is going to be the least effective tool, right? This is going to give you, on average, about 5% weight loss in the long term when you do diet and exercise by itself. Meaning that if you weigh currently around 200 pounds, you can expect in the long term to lose about 10 pounds with diet and exercise, which is great if that is your goal. But if you want to lose more, then it is going to become increasingly more difficult, again, with diet and exercise by itself. Now, diet and exercise, it is a foundational tool. And what I mean by that is that we're going to talk about more effective tools for weight loss in the following slides. But with any of these other tools, diet and exercise is actually a key tool that you have to use and you have to utilize no matter what. Some of these other tools that we're going to talk about, they are not going to work. They're not going to be as effective as they should be if you're not eating the correct things and you're not eating the correct way. And so diet and exercise are going to be incredibly important no matter what we talk about after this. The next tool that we can talk about is medications. And this is a bit of a hot topic right now and over the past year because we are getting more and more effective medications, which is super awesome. I think one of the great things about medications is that we are now getting more options when it comes to these medications. These medications, they do have various side effects. They affect people in different ways and they work in different ways. And so having more options is great so that we can kind of work with you and figure out what works best for you. Broadly speaking, we now have two kind of categories of medications. We have some of the older medications, which are mostly coming in the oral form, meaning that you take a tab or a capsule once a day usually. These newer medications that are coming out, they're injectable medications for the most part, and these are medications that you're going to inject usually once a week. And these newer medications are going to be, in general, more effective than some of the newer or the older medications that have been on the market for a long time. Also, broadly speaking, these medications are going to work in different ways. Most of them are going to work on your brain to some degree and kind of just turn down your appetite and decrease some of that like food noise that happens for a lot of people when it comes to eating in the correct way. So it just makes eating in the correct way a little bit easier for most people. Some of these newer medications are also going to work on your stomach, and they slow how quickly food moves through your stomach so that you stay fuller for longer and that you get fuller faster. And so that's kind of the second way that a lot of these medications are now working. So the pros and cons of medications, the big pro with medications is that it is not invasive, right? But one of the major downsides with medications is that there are a lot of side effects that come up with these different medications. And so sometimes it does take, again, playing around and figuring out what medication works for you and your body can tolerate. Right now, one of the other downsides with medications is that it is often not covered or undercovered by insurance. And especially these newer medications, they are incredibly expensive to pay for out of pocket. Another issue right now is that there are national shortages and it's often very hard to actually get a hold of the medication, even if your insurance does cover it. There is also a question with medications about the long-term durability. Meaning, do I have to take these medications for the rest of my life if I want to maintain my weight loss? And the answer to that is that I would say what the data has shown us is that most patients are going to regain at least some of their weight once they stop this medication. And so the idea with these medications, generally speaking, when I prescribe them, is that we do want to continue this medication long term to maintain your weight loss. That's not to say that we absolutely cannot stop this medication. There are some people who are able to maintain their weight loss long term, but I would say that that is the minority of patients rather than the majority. All right, let's move on to the next topic, which is bariatric surgery. This is my favorite topic. I'm a bariatric surgeon. Um, and this is going to be the most effective means of weight loss out of everything that we've talked about. In general, bariatric surgery is going to give you anywhere between 25 to 35%, actually a little bit more than 35%, not quite 40%, but a little bit higher than 35% weight loss, depending on the surgery that you choose. Um, and what I think is very important to emphasize with bariatric surgery is that it is not just a weight loss surgery. We're actually moving away from calling bariatric surgery, or weight loss surgery. We're actually moving towards calling this type of surgery metabolic surgery because it addresses so many different other health factors um, and your overall metabolic health rather than just address your weight alone. And so it is going to decrease your risk for diabetes, high blood pressure, heart disease, sleep apnea, all sorts of different things. And if you have one of these medical diseases currently, it is going to likely improve these different diseases as well. And so I think that's really one of the most amazing things about bariatric surgery. It's one of the major benefits of bariatric surgery in addition to the weight loss. So who qualifies for bariatric surgery? Um, this is a bit of a complicated topic, I would say, and I would say that these are guidelines that you should consider. Meaning that if you fit into one of these guidelines, then I think it's worth that you have a discussion with a medical provider about bariatric surgery and how it might benefit you specifically. Um, so the medical guidelines for bariatric surgery, and what I mean by medical guidelines is that as a medical community, we feel that if you fit into this criteria, you are very likely to benefit from bariatric surgery from a health standpoint. And those guidelines are that if you have a BMI of greater than 35, or if you have a BMI of greater than 30 with a disease that is related to being overweight. So that includes, the high blood pressure, sleep apnea, diabetes, some of those things that we've already mentioned previously. Now, these are guidelines. And again, like I said before, BMI is not perfect. And so everyone is going to be a little bit different. But I think if you fit into these criteria, it is, again, worth having a discussion with a medical provider that you trust regarding bariatric surgery. The insurance guidelines, I have these included just as a general reference. Every insurance is going to be a little bit different, but generally speaking, insurances will start covering bariatric surgery if you meet a BMI of greater than 40 or if you meet a BMI of greater than 35 with a medical disease that's related to being overweight. Unfortunately, insurance guidelines, they're still kind of catching up to medical guidelines. Hopefully over time that will change. All right. So let's talk a little bit about what is bariatric surgery. I purposely kind of keep this section of the talk short because I do think that there is a lot of nuance that requires a one-on-one conversation. And so we'll kind of just go over the general kind of gist of what bariatric surgery is during this talk. So bariatric surgery nowadays is for the most part done minimally invasively. And here at Aviva, we do it laparoscopically, meaning we make small incisions throughout your belly and we do your entire surgery through those small incisions. We have two major surgeries that we offer when it comes to the bariatric surgeries that we offer. One is going to be the sleeve gastrectomy and the other is going to be the gastric bypass. The sleeve gastrectomy, what we're doing during this surgery is we're taking out most of your stomach. We take out about 80% of your stomach and we leave you with this thin banana-shaped stomach, and it limits how much food can go into your stomach at one time. This surgery takes about 45 minutes to an hour to do, and most of our patients actually can go home the same day of surgery after their sleeve. The other surgery that we offer is the gastric bypass. What we're doing with the gastric bypass is we turn your stomach into a small egg-sized shaped pouch, and then we bypass the rest of your stomach as well as the first 100 centimeters of your small intestine. And then we reconnect the other end of your small intestine to that egg-sized pouch. It's a little bit of a confusing concept, but what we're doing in that process is we're limiting how much food goes into your small egg-sized pouch stomach. And it also limits how much absorption goes on in all of that bowel that we've bypassed. So it works in two different ways, both by decreasing absorption and by decreasing how much food goes into your stomach at one time. This is a little bit more of an involved surgery. It takes a little bit longer to do, and some of our patients do have to stay overnight as well after the bypass. Um, Ultimately, for most, when you come and do a consult with us, when you meet your surgeon for the first time, we will review all of your medical history and kind of figure out if we want to kind of lean one way or the other when it comes to these two procedures. Most patients, though, I would say both of these surgeries are actually very reasonable options. And so during your visit, we kind of talk through some of the pros and cons with the sleeve, the pros and cons with the gastric bypass, and then we come to a decision together with respect to what is best for you. So ends up being kind of a very personalized decision-making process when we choose surgery for you. All right, let's talk really briefly about the endo sleeve as well. This is another bariatric procedure that we offer. And this is not a surgery, strictly speaking. That's why I'm calling it a procedure. So this is the endoscopic sleeve gastroplasty, or the endo sleeve for short, or the ESG for even shorter. And what we're doing during this procedure is we take something called an endoscope, which is a long, thin camera device, and we go in through the mouth, into the esophagus, and then into the stomach. And this endoscope, there's actually another tool attached to it, and with that tool, we are able to put in sutures internally into the stomach. And when we're putting in these sutures, we're actually scrunching down the stomach so that the inside of your stomach looks like a sleeve gastrectomy stomach. So it's going to mimic that thin banana shape at the end of this procedure. But we're not actually removing any of your stomach. We're not making any incisions with this procedure. And so it's very, very minimally invasive. And the recovery time is going to be a little bit more rapid than with the sleeve or the bypass. Now, with the endo sleeve, it is going to be a little bit less effective than the sleeve or the gastric bypass. You're going to expect about a 20 to 25% weight loss typically with the endo sleeve. So you kind of have to weigh the benefits versus some of the disadvantages of the endo sleeve versus the other procedures. But it is an option as well that we offer. All right. Really briefly, I want to mention two very common myths that I hear about bariatric surgery, and I want to address them here. The first is that bariatric surgery is so extreme. And I absolutely understand where this feeling comes from for a lot of people. Bariatric surgery, it is a surgery, meaning we do put you to sleep. We do have to make incisions to do bariatric surgery. But what I also want to say is that bariatric surgery is extremely, extremely safe. It is one of the safest surgeries that we can offer as surgeons. I trained as a general surgeon, meaning I did all sorts of different surgeries. And out of all the surgeries that we can do, like if you go to a hospital today and look at all the surgeries that are being done that day, bariatric surgery is actually going to be one of the safest surgeries that is being performed that day. It's on par with a gallbladder surgery. It's on par with a knee replacement, again, which are both really common procedures that are done day to day. And so when I'm thinking about bariatric surgery and whether or not it can benefit someone, yes, you're taking on some short-term risk with having surgery, but that is often outweighed by the long-term benefits that come with bariatric surgery. And so, yes, it can feel extreme, but one, it's extremely safe, and it comes with extreme benefits as well. All right. The other common thing that I hear, and I hear this almost every single day, is that bariatric surgery is the easy way out. It's cheating, so to speak. And in some ways, yes, bariatric surgery does make weight loss easier. That's actually the whole point of bariatric surgery. It makes weight loss more achievable for a lot of people. Before weight loss surgery, a lot of my patients have tried losing weight over and over and over again and have not been successful. Bariatric surgery is the thing that makes them successful ultimately. Bariatric surgery, it's a tool. And as with any other tool that we have, tools make jobs a little bit easier. They make accomplishing something a little bit easier. But as with any tool, you have to use it correctly. You have to maintain it correctly for it to be kind of used in the best way, for it to be maximally successful. Bariatric surgery is the same way. It's a tool that facilitates weight loss, but you still have to put in the work. You have to eat in the right way. You have to continue to exercise in order for you to lose the amount of weight that we would expect with surgery and then for you to maintain that weight. All right, this is a brief summary of everything that I just talked about. And then I just wanted to briefly talk about what is Aviva. Aviva is the weight management clinic that I work for. We're located in Shoreline, Washington, physically, which is just a little bit north of Seattle. And the thing to know is that if you were to have surgery with us, that can be the only time that you have to actually come see us in person. For all of our other visits that we do offer them via telehealth, meaning that we can do it online through your computer or through your phone. I love it when my patients come to see me in person. Unfortunately, it happens very rarely because the telehealth option is just so convenient for most people. But I think what is more important than what is Aviva or where we're located is actually who we are as a group. And I don't just mean who your surgeon is or who your surgery team is. Of course, your surgery team is very important the day of surgery and in preparing you for surgery. But in many ways, surgery is the beginning of your weight loss journey. And what is more important than your surgeon and your day of surgery is who is going to support you in the long term after surgery. Like I said before, and I can't emphasize this enough, weight loss surgery is a tool, and you have to have the right support to maintain that tool and to use it successfully for the long term. And we have an amazing support team who does amazing aftercare for our patients. And I think that is so important when you're picking a bariatric surgeon. And I truly feel like that is what sets apart a very successful patient from just an average patient. And I would say a lot of our patients are very successful after surgery. And I think the aftercare is the absolute critical key in all of that. All right, so how do you get started with us? The first step is to schedule a consult with your surgeon. And the way to do that easiest is to go to our website, avivamd.com, go to the Contact Us page, fill out the questionnaire. There's just a couple of brief questions, and then we will get a hold of you and get you ready for our visit. All right, so that is everything that I wanted to talk about. Let's go through questions now. All right. So the first question I have is, for someone who has already had the VSG, is GERD, VSG, which is the vertical sleeve gastrectomy or the sleeve gastrectomy, is GERD surgery possible? Which would be more appropriate, the links or the fundoplication? What would be the cost? All right. This is a good question. It's a very specific question, I would say. So this person's asking, they've had a sleeve gastrectomy before, they now have reflux disease. What's the best option moving forward? And they mentioned 2 procedures, including the links or the fundoplication. This is a little bit of a complicated question, and I would say that we would have to have a discussion probably more personally for me to fully answer this question. But to just give this some context, one of the long-term effects that can happen with the sleeve gastrectomy is that you can develop reflux disease. And the reasoning for that is that your stomach is now much smaller than it was before, and as it is now smaller, it is now a higher pressure system. And as with any higher pressure system, the tendency is for that pressure to want to be released. And one way that can be released is that acid from your stomach escapes into your esophagus. And when that happens consistently, that's what causes reflux disease. And so there is a tendency for some people to develop reflux disease after their sleeve. Now, if you do develop reflux disease after the sleeve, typically what I do is that first we do medical management, meaning that we try different acid blocking medications to see if that can be enough to control your reflux disease. And if we've maximized that and that you continue to have reflux disease, then we can talk about doing a revisional surgery. For this person, I would say, a fundoplication is not an option after your sleeve gastrectomy. With the fundoplication, what we're actually doing is we're wrapping part of your stomach around the area between your stomach and your esophagus to kind of tighten that area up and prevent acid from refluxing into your esophagus. But with the sleeve, you don't typically have enough stomach to actually perform a fundoplication. The LINX is an option when it comes to addressing reflux after the sleeve gastrectomy. I would say it's not a standard use of the sleeve. The standard use for the sleeve is in reflux disease with someone who has a normal sized stomach. And so it's a little bit of an off-label use of the LINX device, I would say. What is most common when it comes to someone who has severe reflux disease that's not controlled by medications after the sleeve gastrectomy is we do a revision to a gastric bypass. The gastric bypass is actually a reflux operation to begin with, and so most patients have resolution of their reflux disease with the conversion to the bypass. And so I would encourage that we have a discussion, person to person, and learn a little bit more about you and the symptoms that you're having. But I think this is also good context for many people to know about the reflux disease that can happen with the sleeve gastrectomy. Now, let's see. Stephanie also sent in, I think, 2 questions. I have had AFib, lung cancer, and surgery twice in the last 4 years. I'm scared that this won't work. Okay, I'm scared that this won't work. That's a great question. And again, I think this kind of comes to like the anxiety that goes into having another surgery. If you've had a history of surgery in the past, that does not preclude you from having a bariatric surgery. Many of our patients have had various surgeries in the past, and we can still successfully do a sleeve gastrectomy or a gastric bypass for you. Specific medical history, again, these are things that we'll want to talk about during your consult. We do a very thorough review of your medical history just to make sure that we can safely do surgery for you. It's very common for our patients to have various medical histories and medical problems that we can then address at the time. And again, a lot of these medical history items, they don't preclude you from having a bariatric surgery. It is normal also to feel anxiety, to feel scared about even just coming to our visit, even coming to see us. There is so much that goes into weight and being overweight and struggling with the weight loss process. And I know that coming to see us for the first time can feel very intimidating. It's normal for a lot of my patients to feel anxious during that visit. And what I tell people is it doesn't hurt to learn more information, right? It doesn't hurt to come see us, learn a little bit more about the risks that are specific to you, the risks of surgery in general, and the potential benefits that you might get from surgery. So, what I would encourage is if you are interested in bariatric surgery, it does not hurt to meet a surgeon and figure out whether or not bariatric surgery is going to be a good option for you and learn a little bit more about how it might benefit you. All right. But it's, again, very normal to feel anxious about the process. All right. Another question that we have is, how do you choose between the endoscopic sleeve and the lap sleeve? That's a great question, and this comes up pretty often. It is ultimately going to be, in terms of choosing any of these tools, medications versus the endo sleeve versus the lap sleeve versus the gastric bypass, or even just diet and exercise, right? All of these different options, it's going to be a personal decision for each person. Each of these options have pros and cons. They have disadvantages and they have advantages. For the endo sleeve in particular, it is going to be a little bit less effective than surgery, like the lap sleeve, but it is going to be less invasive. So it is going to have a little bit of a faster recovery than the lap sleeve. So you have to weigh the pros and cons, right, with each of these things and figure out what feels best for you. At the end of the day, what I can do for you as your surgeon is tell you all the information so that you are aware of what the advantages are, what the disadvantages are. And ultimately, it is going to be your decision in terms of what feels best for you. Every person is different, so everyone lands to their conclusion in different ways as well. So, all right. I also did get another question about pricing. I don't have like the most up-to-date pricing information in the back of my head usually, so we will have someone reach out to you and um, kind of give you a little bit more details about pricing in particular. Okay. All right, let's see if there's anything else. Okay, I think that is everything that we have for today. All right. I hope this was helpful for everyone. Um, I hope this was helpful. If you have any other questions, feel free to call us at Aviva, or this video will be posted as a YouTube video, so feel free to also just comment with your questions and we'll get back to you. All right. Okay, take care.